Welcome to The Explainer. Today, we're diving into a medical mystery, and by stepping into a doctor's shoes, you're going to learn a really powerful way of thinking called clinical reasoning. So, let's jump right in.
Okay, let's kick things off with a scenario that, let's be honest, would worry any of us: finding an unexpected lump. How a doctor tackles this seemingly simple problem, well, it reveals this fascinating step-by-step way of thinking that you can actually apply to solving almost any complicated issue.
So, here's our case. It starts with a 50-year-old woman. For the last 2 months, she's had this painless lump in her neck. It's not going away, so, she's come in to get some answers. This is ground zero for our investigation.
All right, just like any good detective story, the first thing you have to do is gather the clues. We've got to build out the full picture of what's going on before we can even start to guess what might be happening.
So, first up, let's look at what the patient is telling us. We know about the 2-month-old painless lump. But here's where it gets interesting. What's missing is just as important as what's there. See, she has no fever, no weight loss, no night sweats. In the medical world, these are called B symptoms, and they're huge red flags for systemic stuff, like lymphoma. The fact that they're not here, that's a massive clue. It tells us we probably need to look in a completely different direction.
Now get this. Look at her vitals. Blood pressure, heart rate, breathing, temperature, they're all textbook normal. This is where the plot really thickens, right? The most obvious signs that something is wrong are just not there.
And her blood work, it's singing the exact same tune. Her white blood cell count, the thing that usually shoots up when you have an infection, is sitting right in the normal range. Platelets, hemoglobin, everything looks great. On paper, she seems perfectly healthy. Okay, so let's piece this together. You've probably heard of Occam's razor, right? The idea that the simplest explanation is usually the correct one. Well, the simplest thing here would be some kind of infection. But with no fever and normal white blood cells, all the evidence is pointing away from that simple answer. These negative results are actually incredibly helpful. They're telling us to dig deeper and look for something a bit more complex.
And that brings us to a major turning point in this case. We've got our first batch of clues, and we've already ruled out the most obvious culprit. So the big question now is, what do you do next? This is where that real clinical reasoning kicks in.
Okay, so a doctor is looking at 5 possible paths here. They range from let's just wait and see, all the way to let's do surgery right now. Each one is a different strategy, but only one of them is the most logical next move. Let's see if we can figure out which one it is by doing what the pros do, eliminating the wrong answers first.
The secret to great diagnostic thinking isn't always about having a flash of genius and knowing the right answer instantly. It's often about systematically understanding why all the other options aren't quite right. It really is a process of elimination.
So we can toss out option C, antibiotics, straight away. Like we just saw, there are absolutely 0 signs of an infection. Prescribing antibiotics here would be like calling the fire department for a leaky faucet. It's just not the right tool for the job. It doesn't solve the real problem.
All right, what about option B? Just wait and see? Nah, that's not the right move either. This lump has already been around for 2 whole months. You just don't ignore a persistent, unexplained symptom like this. The time for waiting and seeing is definitely over.
Okay, so how about we just jump right to surgery? Option A. Well, that's way too aggressive at this point. That's a major, invasive step, and we'd be going in blind, without really understanding what we're dealing with. You just don't do surgery without a much clearer picture and a very compelling reason.
And last up, option E. Send her to an oncologist, a cancer specialist. Now, this is a tricky one. This might absolutely be where this is headed, but it's just a bit premature. An oncologist is going to need more information to even start their work. The referral might be part of the plan, for sure, but it's not the immediate next step to get the data we need. So, after we've carefully crossed off the options that are either useless, too passive, too aggressive, or just plain premature, the most logical, sensible path forward becomes pretty darn clear.
And the correct next step is option D, a CT scan of the chest and abdomen. At this stage, this is the move that's going to give us the most critical information with the least amount of risk.
So why a CT scan? Why look there? Well, there's this cool principle in medicine called Sutton's Law. It's named after a famous bank robber, Willie Sutton. When a reporter asked him why he robbed banks, he supposedly said, because that's where the money is. For a doctor, that means you go looking for the problem where it's most likely to be. And a persistent lump in the neck, without signs of infection, very often points to something going on in the chest or abdomen.
So the CT scan is basically the doctor going where the money is to see the whole map.
So, the CT scan was the right answer. But it wasn't a lucky guess, right? It was chosen because of this powerful, logical way of thinking. So let's really break down what this whole case teaches us about that process.
Really, the big takeaway here is that clinical logic is a very intentional step-by-step process. It teaches us that a symptom that's been hanging around, even if it doesn't hurt, always needs to be looked into. It shows us that normal test results don't mean stop looking. No, they're valuable clues that help us narrow down the search. And maybe most importantly, it proves that diagnosis isn't about wild guesses. It's about methodically gathering information and logically ruling out possibilities one by one.
And that really leaves us with one last thing to think about. When you understand this kind of structured, logical process, it gives you a whole new appreciation for what's going on behind the curtain. It's a great reminder that even a simple symptom can be just the first thread you pull that ends up unraveling a much bigger, much more complex puzzle hidden from view.